Hello, everyone. Welcome to EMD Media Show. EMD Media works on understanding, measuring, and doing, and we try to contribute for an evidence-led, evidence-rich, evidence-based discourse and decision-making in the Horn of Africa. Today, we are back with the health state of Tigray, and we'll be conversing with Dr. Hailay Abrha and Professor Kiros Berhane. Welcome, gentlemen, to this show today.
Thanks, Getachew. Thanks for having me.
Thanks for being here.
Great. Professor Kiros was here as the media before. Dr. Hailay, the new guest to our show. You can find Professor Kiros Berhane at LinkedIn. He's a professor and chair at the Department of Biostatics at Columbia University. And Dr. Hailay is a public health PhD, and he works with Flinders University as a research fellow. So today, since November 4, 2020, there is a lot of talk about Tigray in general, Tigray genocide, all that. And today we want to go deeper into the health state of Tigray. And the starting point for us is your publication. You co-published, I think, it was published in November 2021, this paper on, I think, let me just put that here. This is a paper, The Impact of War on Health System of Tigray Region in Ethiopia, an assessment. You are the co-authors among others. So maybe I want to start with you, Dr. Hailay. What was the picture when you published this paper in terms of where Tigray was compared to where it was before November 4, 2020?
Yeah, thanks, Professor Getachew, again for the opportunity. So, yeah, as you tried to mention, we have published this paper on, I guess, a couple of months ago, and when we see the numbers, they're very staggering, right? So, Tigray, when we see the health system of Tigray, it does have the promotive, the preventive, the curative, and the rehabilitative program, right, in general. So the so-called three-tier system. So that was before the war, but after the war, more of, completely the entire system is collapsed. So if we just see one by one, say from the infrastructure-wise, so Tigray has, around 1,000 health facilities before the start of the war. But after the start of the war, like more of the great majority of the health facilities are either completely collapsed or they are destroyed or non-functional. Of the hospitals, like 72% of the hospitals in Tigray are now non-functional, when we compare after the start of the war, right? And of the 200 plus health centers, 87% of the health centers are now non-functional. And Tigray has around like 741 plus health posts, which are completely functional. But then after the start of the war, almost 100% of these health posts are non-functional. So when we say, health posts, so they deliver the very basic primary services of providing health information, providing family health services, providing information on communicable and non-communicable illness. So all of this now are non-functional as a result of the war. And again, as part of infrastructure, if we see the ambulances, so Tigray has around 270, 280 ambulances before the start of the war, which, the great majority, like 56% of these ambulances used to give maternal and child health services, particularly, the delivery services. But then 90% of the ambulances now, we don't know where they are. So their whereabouts is unknown, right? So, and when we see the infrastructure-wise, again, Dr. Hagos has released a very recent opinion piece, which we didn't mention in the paper, that almost 78% of the health postes are like destroyed. So we say 100% of them are non-functional, but again, in terms of infrastructure-wise, 78% of them are completely destroyed. 70% of the health centers are destroyed, and 8% of the hospitals are too. Right. So it's very, very almost a near total collapse. Now, like, I want to give a very good picture, of either hospital before I go into the details, because that's the best hospital in the region. That's a referral hospital, and probably if we see that, that's the hospital that left with 150 vials of insulin. So for 20,000 plus DM patients, the hospital is remained, with just 150, with 150 vials. The health professionals said they run out of expired drugs, and very sadly they even are using the traditional white clothes instead of gauze for basic surgeries, right? So that's at the referral hospital level. And if you see the availability of the essential drugs, it has 80% before the start of the war, but now that level of basic essential drugs goes down to 20%, and we know patients are dying because of lack of oxygen. So if you see the hospitals, the health centers, and the health postes, we would say like almost 85% of them are either destroyed, collapsed, or totally damaged. Now, what does this mean, right? So what's the meaning of this near total collapse of these infrastructures? If we see in terms of maternal and child health, like I would say the access to antenatal care, access to delivery, access to postnatal care is completely collapsed. A very simple example, in the first 3 months of the start of the war, as we also mentioned in the paper, about 45,000 mothers didn't get access to antenatal care, right? So when we say they didn't get access to antenatal care, like, we don't know whether the mothers, the pregnant mothers are bleeding. We don't know whether the baby inside the tummy is moving. We don't know whether the mothers are anemic or not. We don't know whether they have got hypertension or not, right? So that number, 45,000, in just only 3 months, they didn't get this ANC. So you can appreciate, or you can extrapolate, its impact in the complications because of lack of screening in the ANC. And then UNICEF came with a very recent report mentioning that 61% of the pregnant or the breastfeeding mothers in Tigray are acutely malnourished, right? So if you just pick 100 mothers in Tigray, 61 of them are acutely malnourished. Now, what does a pregnant mother or a breastfeeding mother is acutely malnourished? So obviously, because there is no adequate nutrition, so the mother can't give food to the fetus. So there is high chance of days of the fetus, so the so-called stillbirth, right? You displayed this. A head of gynecologist called Professor Berhane, she mentioned that about 250 children were actually born with anomalies, like no hand, no legs, with complications, and like around 60 of them actually born died, right? So if there is no adequate nutrition of pregnant mother, there is obviously an opportunity of days of the fetus. Again, if the mother doesn't have adequate nutrition, she doesn't have enough breast milk. So obviously, even the breast milk baby is either going to die or exposed to severe illnesses. And I will come later, like 1 in 4 children in Tigray are at risk of death. So that includes the breast milk feeding babies, right? And then obviously she's malnourished, so there is high risk of death. So you can see, there is a days of a fetus, there is a days of breast milking child, and there is a days of mother. So you can, if someone wants us to, commit effective genocide, it's just easy, killing the mother and her babies, right? So that's basically the display of the entire thing was happening in Tigray. And obviously, because of the lack of access, the prevention of mother-to-child transmission, the service of PMCT is completely collapsed again. So if there is a HIV positive mother, then there is obviously a risk of giving a birth of a baby with HIV, right? But previously, if she would have taken the prophylaxis, then there is a chance of having HIV-free baby, and that system now is completely collapsed. Now, as I said, if we see the children, like almost 100,000 children in Tigray are at the risk of death. Okay, that's nearly like 1 in 4 Tegaru children. And even in terms of vaccination, Tigray is one of the best, if not the best, from Ethiopia in terms of vaccination coverage. The great majority of children got the basic, like say out of 173 children used to get a basic vaccination service, right? But now almost 900,000 children are waiting polio, which they didn't get, and almost 800,000 children didn't get measles. And of this, only 145,000 of the children got the measles vaccine. Okay, so it's very easy to guess if children didn't get vaccine, at least they are going to be affected, by the vaccine preventable illnesses, right? Such as poliomyelitis, in case of if they didn't get polio, and if they didn't get other vaccines such as measles, there is high risk of the mental retardedness, right? So the impact is not just immediate, so it can go to the long ones. Now, if we see in terms of communicable and non-communicable illness, so as we mentioned in the paper, again, because of the system is completely collapsed. So now any infectious illness in Tigray is almost getting a killer disease, right? So a disease which could be treated by antibiotics of 5 to 7 days, but because of that lack of antibiotics, like people are dying because of this infectious illness. In Dr. Hagos's opinion, when he tried to cascade the cause of morbidity in the snapshot, infectious illness were the top killers. So they contribute around 32% to the 32% of the deaths, right? But those are obviously a preventable deaths. If the people could get, antibiotics of just a maximum of 10 days, we could have averted this much deaths. Again, the system, not only the illness, but if we see the system, for instance, COVID system, Tigray prepared around 4,000 beds for COVID management, and they installed 6 laboratory sites. But after the start of the war, only 35 beds remained to the COVID management. So the rest is become just history. And of the 6 lab sites for COVID, only 1, which is only in Mekelle, is functional. So you can see, people cannot travel to Mekelle. There's only 1 site, and it doesn't have that logistics. So you can see the severity by COVID, and that's the same the impact for the rest of the infectious illnesses. In terms of the NCDs, or communicable and non-communicable chronic illnesses, before the start of the war, there were about 180,000 communicable and non-communicable illnesses, which they used to get a regular chronic follow-up. So they used to take their medication regularly, visit the health facilities, to not only to collect medicines, but just for the general follow-up, right? But after the start of the war, because, for instance, for the first 3 months, all these patients completely stopped, and they didn't get the treatment for at least 3 months, right? So it's very easy to guess, for a single HIV patient, let alone not taking antiretroviral therapy for months, if an HIV patient didn't take it for 1 day, the number of viruses just goes up, multiplied in millions, right? And this is in a place where there is no adequate nutrition. And where there is no adequate nutrition, the problem becomes exponential. So the risk of more than 44,000 of HIV patients to death is very, very high. But the thing is, when we think that of the infectious or non-infectious chronic illnesses, I would say it's increasing or it's decreasing. It's decreasing because there is no medication, right? So if there is no medication, probably the patients are going to die anyways, and before they die, there may be lots of complications, right? But there is also high probability of increasing new cases for these chronic illnesses. The rate of incidence or the number of new case or incident cases for HIV, for diabetes mellitus, and for hypertension may be increased. This is because the risk factors are there, right? For instance, if you take HIV, there is high displacement, like almost 2.2 million people in Tigray are displaced as the result of the war. There is no condom, and there is no health promotion services. We will come later. There is huge gang rape. So all this increases the risk of HIV positivity, right? And because there is no prophylaxis, obviously, if there is a pregnant mother who is HIV positive, and obviously the virus will transmit to the child, so the incidence rate of HIV will increase. The same for the other non-communicable chronic illnesses. So, like, the risk factors for most of the chronic illnesses, such as diabetes mellitus, hypertension, and others, are, stress, exercise, and the nutrition itself. So there is stress everywhere in Tigray. Tigrayans they can't go to public markets because there is a fear of drone attacks. In the World Food Program report, they said like 1 in 3 people in the city do not want to go to a public markets because they fear there is a risk of bomb shelling, right? And Tigrayans are worrying because they lost their loved ones. Tigrayans are worrying because they're thinking food, they're thinking what to eat. So you can see the stress is there. So that's a risk factor for increasing the new cases of the stress-triggered chronic illnesses. The same exercise. If people do not, if people fear not to go to outside, they prefer to stay at home. So that means there is no exercise. If no exercise, there is the risk of other chronic illnesses. We know lack of exercise is, one of the risk factors for the great majority of chronic illnesses, right? So the same is true for the others. So you can see there are incident cases. Obviously, there will be an increment. But again, because of there is no medicine, because of there is a medical siege, which we will come later, I guess, the mortality due to this communicable and non-communicable chronic illnesses is very, very high. But that's not only the problem anyways. If patients do not, for instance, if HIV patients didn't take ART according to the prescriptions, obviously there is a risk of drug resistance, right? So the impact is not only to the current patients, but the impact is even to the coming new patients, so that medications will not work as a result of the drug resistance. So this works for the other illnesses as well. Now, if I continue with the with the gender-based violence,
maybe we'll come back to that.
Yeah.
Highlight. Thank you. I mean, this is a grim picture on what has been happening. Professor Kiros, you might add on that, and given your work on that, this was what Dr. Hailay was also mentioning. This is from Dr. Hagos Godefai. He's the Chief Health Officer or the Bureau of Health in Tigray. So, what does it mean to, where Western Tigray is still under Eritrean and the Ethiopian forces? There is a lot as well in terms of northeastern Tigray, northern Tigray still not under the control of government of Tigray. But what does it mean in terms of understanding, measuring, and knowing, the extent of these pictures that Dr. Hailay was painting?
Yeah, thank you very much. And again, I would like to thank you for giving us this opportunity. I'm not going to go back to the numbers because Dr. Hailay has done a very good job of summarizing the statistics and giving the real picture, actually, of the level of collapse. Just to summarize and give my perspective, I think there are really 4 pillars that we can focus on in terms of what the damage is all about. First of all, as Dr. Hailay mentioned, there was a vibrant health system. Now it's totally collapsed. There was even a health insurance system that is overwhelming, doing, or even low-income families could either use public facilities or even finance some of their health systems. Now, as we know, they don't even have access to their funds, let alone for medication, even to eat and to sustain their lives. Again, as Dr. Hailay mentioned, there were a big network of hospitals all the way from tertiary, which served not only the Tigray region, but even the surrounding regions, in Ethiopia. Very high regarded and very well, run referral system, and all the way up to primary hospitals. Those are either non-existent, deteriorating, or non-functional. And then the well-trained workforce, actually, that was really, really, well-skilled, experienced. And again, they are either displaced, unpaid, or unaccounted for, even in the areas of Tigray where the government of Tigray is in control. Now, as you mentioned, there is a good chunk of Tigray that's not under the control of the government of Tigray, and we don't have any data on what's going on. And whatever bad statistics or grim statistics that Dr. Hailay mentioned, you can magnify it and multiply it, because the situation is actually worse than what the other parts are experiencing. So what does all that mean? So it's really catastrophe. I mean, there is no other way to describe it. The total collapse is essentially rolling back the clock, not only 20 years, where we have seen a steady growth in terms of health metrics, improvement in life expectancy, the mortality rate in children, the mother to child care, care for non-communicable disease. All that is actually rolled back not only 2 decades but multiple decades. So essentially, we are wiping lots of gains that have been achieved over the last 15, 20 years, but we're actually going even back further. Now imagine that all is happening in the face of increasing need for the health system. There is a lot of trauma from the war injuries, from deaths. There is a lot of mental illnesses and stress that's happening because of all the atrocities people are experiencing. Dr. Hailay mentions the gender-based violence, rapes, unwanted pregnancies, new STDs, HIV/AIDS, and other sexually transmitted disease. All these are actually new burden on the health system. But as we have said, the health system actually has collapsed. So I think you can basically imagine how bad things are. And then one other thing I would like to stress is actually all the numbers that you have seen in the papers that we published, it's actually up to June 2021, right? After that, maybe there wasn't any more destruction except what happens through drones and aerial bombardments. But all the health professionals are unpaid, and the medications are actually dwindling almost to non-existent status. So the collapse is actually way worse than what Dr. Hailay mentioned in his summary, simply because of the siege and the blockade. So again, both in the government-controlled areas by government, I mean the government of Tigray, and the areas of Western Tigray, where again, as we hear from reports, there are untold atrocities still going on, displacement of people, and again the drone attacks and so on and so forth. So all that basically paints a picture where we're really witnessing a catastrophe, a tragedy, and something that can only be described as genocide, something that can only be described as a total elimination of a system, but also of people in a way, right? So I think that's basically how I would describe it.
Yes, so what we are seeing is the health professionals of protesting. And if they are not exiled, if they are not already dead, they are not paid. Yeah. They are working in a very difficult situation. This is months ago they were protesting. But the other one is early on, after the war started, people noticed already the lack of medication was killing people who would have, lived longer lives. So this is a BBC report way back after the start of the war. But things are getting worse. So let's listen to that and we'll come back. This is my brother Kiros, and his mom died within months after the start of the war, simply because she couldn't get the medicine that she was using for years before that.
سلام كما تخونو شماي مبراتو حاجوس يبال أو يونايتد ستيتس كعي أمد كما جمرت حدار جميرو أو تقرأ بذكار زلو طورنت مهنات عدي ولاديتي كابتن مدحانيت كزيام كي تقومو تخل كيلوم بمدحانيت سانو مدحانيتهم وديهم زموتو وغناتنا حانتيا عدي كابكر مش دشت عامت جميرا مغلاب ذركب عايدر هوسبيتال ورحا وقت التلنا قورتن مدحانيتنا هتقمتن ياتنبر نيرا يطورنت نتجمر نورحا وقت التلان مدحانيت ريفيل لمقوارن كل تسومني ترفانيرو تخونقن مقع عزيان بانكن تعاسيو فارماسيتات تسريقهم هوسبيتالاتون كلن أم حاسير قزيس لزعانوا عدي دكتورات تمهر اللوخنا مدحانيت تقزر لعدل كيرخوت ديسمبر 15 عريفة.
The war started just when she was 2 weeks away from her refill, but we are seeing this social media posts increasingly more this week and the last couple of weeks. This is one on Twitter. His uncle died again for lack of medical resources. A number of them. Just this is a sample. This is a grandma of someone dying again because she couldn't find the medicine and so on. So with that, and even a medical doctor was on media, couldn't control his feelings. So let me play that one, and then I want Professor Kiros to continue on that in terms of what this is when it comes to combining it with starvation and then aggravating it.
መድሓኒታት ግዜኡ ዝሓለፈ ዳተጠቐምና ነርና ሕዚ በሰዓት እዚ ግን ተኤክስፓየር ዝገበረም ተወዲኡ ስለዚ በቃ ኣብ ኮምፕሊት ዝኾነ ሾክ ተሓካማይ መጽኡ ይበኪ ተሃገብር ኢሉ ያው مسؤول مكاتب يخون تفلي أنت ولا تجري تعدلك
Yeah. Prof?
Yeah, so actually there is a very interesting article that was published today by Dr. Berhane. I don't know whether you have seen it. I'm not sure whether you have chat, but he's an agricultural expert, and he actually tried to paint a very, very realistic but grim picture about the impacts of famine, and he discussed it in conjunction with the health stresses as well. So, I mean, as you know, almost about more than 5.2 million people, or probably over 90% of the population, maybe a little bit less, of the region is actually in need of emergency aid, and for nearly almost a year now. And then there are famine and famine-like conditions. Some numbers put it at 400,000, and other estimates actually have put it almost like at 900,000 or even more. Now, add that to the lack of medication and all these stresses on the health system, then you really have a recipe for disaster, right? So if you look at children, infants, then all the health indicators that have been achieved are being wiped out because the mothers don't have anything to eat. The children don't have anything to feed from, whether they are breastfed or not. And very standard indicators of health like acute malnutrition are actually really, really going up. According to Dr. Hagos, for instance, malnutrition in children under 5 has it almost like 29%. And of these, actually about 7% or so are diagnosed actually with severe acute malnutrition. Now, if you compare that with what the standard or threshold is for the global emergency numbers, it's supposed to be 2 or under 2%, right? So you're really going way above what the recommended minimum levels are or maximum levels are. And then even the other 22% actually has this what we call moderate acute malnutrition. So that is partly because of the mother-child care, but for the most part, it's actually the famine-like conditions that are a result of the siege and blockade that are compounding it, right? When you go to the other flip side of non-communicable disease, people with diabetes, people with heart conditions, many other, treatable, manageable conditions, there is lack of medication, and then there is also the lack of food, where in the absence of nutrition at the entire spectrum of age, you really, again, hitting people from many, many different directions. And you can, of course, imagine what the outcome of that is going to be. Now, the other worrying aspect is actually, the impact on the infants and children. As we know, we have, terms like, stunting and wasting, and even very slow cognitive development in children. Now, this impact, the impact of the conflict actually is not only the immediate, it's not only the short term, it's actually the long-term impact of the children that are growing under these conditions. If they survive, if they are lucky and they survive, then what kind of young people, what kind of adults are we producing 20 years from now, 30 years from now? So the impact could be long-term, both for the person, but also for the society as a whole, because there are actually studies that show, not well nourished and well, cared for generation of children could actually lead to significant and appreciable deterioration in economic growth at the country level, at the society level, right? So the impact is actually multifaceted. It's going to be reflected in the well-being of the people themselves. It's going to be reflected on the well-being of the country or the society itself. And it's possible that it's going to be potentially multi-generational, if not at least generational. So we have to look at it kind of from the long term point of view as well, not only the acute and immediate, which is catastrophic and really worrying and almost makes you cry with despair, but looking forward the implication is going to be really long-term and devastating.
Thank you, Prof. Dr. Hailay, you want to continue where you stopped. So you were mentioning about the sexual violence, and there was even a report by Amnesty International that there was a purpose-driven or intentional infection of women with HIV and so on. So you want to continue on that?
Yeah, I will continue, and probably I might add also, some pointers on what has Professor Kiros been mentioning. So, with regards to the gender-based violence, well, as you said, yes, it is systematic. But what's challenging here is obviously we don't know how many women and girls were gang raped, and I don't think we will know anyways. If you see the experience of the Rwandan genocide, still now they didn't know how many women and girls were raped, right? So they say the range is like between 250,000 to 500,000 women and girls were raped. That's the confidence interval. So the same thing in Tigray. While we were writing our report, we couldn't get any reference, right? So one of the British MP, she mentioned like about 10,000 women and girls in Tigray were raped, but we know that it's more than that. UNFPA came with a latest report that and they said that about 52,500 women and girls were gang raped, right? So obviously the numbers are very different, but I want to focus on the characteristics rather than the numbers, because obviously the numbers will vary by time. USAID released a report, and one of the co-authors of the report was Helen Clark. She was a former Prime Minister of New Zealand. So they tried to clearly put it, the characteristics of the gender-based violence happened in Tigray. Number one, there was a sexual slavery, right? So that's one of the characteristics of that report. They said 39% of the women and girls were raped in their home. 21% of them were raped in military camp. They took them from their house and then raped them in the military camp. And 18% of them, they raped them while they were walking on road, right? So this thing shows purely they used sex, as a slave. But what's worrisome is, there was an intention to humiliate the girls. So they did it on purpose. So remember, Tigray is a very conservative society, let alone, committing such kind of horrendous stuff. Even doing, the normal, sex, they just do it, under, off light, right? So you can imagine how the society is very conservative. But what they did was 33% of those girls, they raped them in mass, right? So they just collect them, and they just gang raped them in mass, and that was intentionally to humiliate them. And more horrendously, like almost 76% of them, they were raped by more than one perpetrators. Okay, so just for one girl, I saw a report that she was even raped by, I think, about 8 perpetrators. So you can see there was a multiple perpetrators. And then who are those perpetrators? So in that report, it says 44% of them were Ethiopian soldiers, and then 33% of them were Eritrean soldiers. 6% of were the combination of both Ethiopian and Eritrean soldiers, and 6% of were the Amhara Fanos and the militias. So these were the perpetrators. But if you see, it was actually very widespread. All these things happen in the east side of Tigray, central, west, and almost all over the world. And if you see by age, I think it was as young as 8 years old up to 81 years old, right? So they did this basically to humiliate. Imagine if you know, a woman of priest is raped. Imagine if a nun who never seen, you know, just, you know, male were raped. Imagine, you know, just a virgin girl who is waiting his time to marry is you know, raped. So the intention was very very damages. And as you tried to also display, you know, they did an intentional infection of HIV/AIDS, and they actually you know, did an intentional damage to their reproductive system. So, you know, they tried to insert a hot metal to their privates, and they also, you know, as you display, they purposely infect HIV/AIDS. So literally, like what has been done in Rwanda, they actually organized a rape squad, right? So they bring HIV positive people, and then they put them to have a sexual intercourse. You know, the girls even say that, yes, we are already HIV positive, so please, if at least, what if you have what if you do condom? They asked them, but they said no, because we are coming here to infect you. And that's what they said, right? So on purpose, they infected them HIV, as I have mentioned before. Not only that, but they don't want Tigrayan mothers to be fertile, right? So that means purposely they want to damage their reproductive system. So what does this mean? I would say, yes, rape was used as a weapon of war, right? All this thing clarifies that rape was used as a weapon of war. So that's with regards to the, you know, gender-based violence. But if I come to what Professor Kiros has been saying and what you're also trying to mention, you know, especially when you don't give, when you don't allow medications to hospitals, when you don't allow salaries to health workers, and when you do this in purpose, I think all this to me shows that the healthcare system in Tigray was weaponized. So healthcare as a system of war was used as a weapon of war. But let's try to see conceptually, what does weaponization of healthcare system mean, right? So if you see, at least there are 4 things or 4 indications to say a given healthcare system is used as a weapon of war. I think number 1, if, you know, the health system was targeted. Now we have tried to mention the numbers, like almost 70+% of the health facilities were destroyed. Is this intentional? I think yes. You can't do this by mistake, right? So almost 70% of hospitals, 70-80% of health posts, you can't distract them unconsciously. So obviously this is quite intentional. But they you know, one of the generals called General Abrha Taddese, he himself said, you know, the main aim was to distract the facilities of Tigray. That was what he said word by word, right? So when we say facilities, it includes pharmaceutical factories. You know what had happened to the Addis pharmaceutical factory in Adigrat? It was completely looted, right? So that was targeted. And health facilities, I mean, facilities to me includes the health facilities, you know, the hospitals, health centers, and so on. So the general, he himself said, they proudly say they try to demolish the facilities. And to me, that shows, yes, there was an you know, intention or target to the health facilities. But what's worse is they try to even actually you know, didn't allow non-governmental organizations to give service. They suspended MSF. They suspended, you know, the Norwegian Refugee Council, because they were non-governmental organizations who used it to give services to the people of Tigray. But they even, you know, suspend this. So you can see how it was targeted and how it was systematic. So if you target the health facilities, that's one indication of weaponization of war. And the second one is if health workers are targeted. Now, were health workers in Tigray targeted? And the answer is yes, because we have heard the days of at least 10 health workers in the first 3 months of the war, right? We know it's more than that, but at least we got the report of that. We got a report that about 2,000 health workers were enrolled in one IDP center in Mekelle. So they were displaced. Obviously, they are targeted, right? Getachew, you've been mentioning that, and Professor Kiros, of course, those health workers didn't get their salaries, like for most of the months since the start of the war. But at least we know that since June, like none of the health workers are paid. They couldn't use their savings because the banking system in Tigray is not working. Now it's very sad to see doctors were begging for food, right? So in Tigray, I would say doctors are one of the highly paid health professionals. Now, not only from the health profession, but even from the other professions. So when you see a highly paid profession, but now when they beg a food, you can see how the health workers were targeted. But we also heard UN lost about 23 aid workers, MSF lost 3 staff, and all this to me paints that health workers in Tigray were targeted. But again, if in regards to the gang rape, right? In Tigray, health workers are women by design, right? So there were about more than I would say like 15,000 health extension workers, and these are women by design. And I would say some of the women may also be affected by the gang rape. So all this to me shows healthcare workers in Tigray were targeted, and that shows yes, there was a weaponization of war. And all these are actually in against the 1863 IRC declaration that health workers should work freely, and obviously that's also against the 1949 Geneva Convention. And I think the third character or the third indication to say healthcare system is weaponized is if there is obliterating medical neutrality, right? So we know the soldiers were interfering the medical system. Probably you might have the soldiers in Tembien, they completely changed the hospital into a military camp, right? And they didn't allow any civilian who is living around to get healthcare service in the hospital. So we can see the soldiers were trying to interfere the health workers and the healthcare system, and that's to me obliterating medical neutrality, which is an indication of the weaponization of war. And I guess the last one is besieging medicine. That's the fourth criteria to say a given healthcare system is weaponized. Was there besieging medicine in Tigray? I think yes, and still now actually. That's why we were trying to see that either specialized hospital, one of the best, is remained with 20% of the basic medicines, as opposed it is to have like 80% a year ago before the start of the war. So to me, all these things show that the healthcare system in Tigray is weaponized. But if you also see everything is done actually systematically, right? I will try to give HIV, as an example how things were systemized. So, they block resources such as condom. All the health promotion thing is not given. So obviously there will be, the new infection of HIV. Now, because there is no testing services, people do not know whether they are HIV positive or not. If they HIV positive, they would have, get tested and get treatment. But because there is no that kind of service, there is a delayed diagnosis, there is a delayed linkage to treatment. So, they know, yes, that delayed obviously brings a negative HIV treatment outcomes. But even if they know their HIV status, they can't escape to other areas, right? So if they, for instance, think they might get treatment in Sudan, they can't go to Sudan because Tigray is already blocked. They might go to neighboring region, but they can't because it's already blocked. So they know, they even HIV patients who didn't get treatment in Tigray can't go anywhere. And obviously, if the treatment is delayed, then the AIDS, the patients will progress to AIDS, and then the AIDS progress to HIV. So all this thing will increase, the mortality. So I would say, they prevent the basic, prevent the promotive services, they prevent the curative services, and again, they prevent the rehabilitative service. So you can see how everything was done, systematic. So that's the point I want to make, particularly how the Tigray healthcare system was really, really weaponized.
Thank you on that. Maybe I want to play the doctor who explained their difficulties. The audio might have a problem, but let's play that.
Of course, with this pain, and finally, sadly, these patients have severe pain. Probably it could be endured because of the surgery, or it could be because of the tumor. Since you don't have CT scan in the MRI, at this stage, every patient with colorectal cancer was supposed to have CT scan in the MRI. But we didn't provide him with CT scan in the MRI, and probably with this imaging, he might be also upgraded or upstaged. And the pain could be due to the cancer itself also. So this patient is a weight patient. He have a middle income, he have good life standard. He lives here in Hailay. And he asked me that I can buy any drug. I can sell my car, I can sell my house, and I will bring this medication. Tell me where I can find it. Again, we can give him this drug. It's not even in the private clinics. People with money, hardly earned money in their whole life, they can't even get this medication. It was so easy to get because this one. And then I told him that no, we can't find this even if you have $1 million. No one can help you understand. And as in, so I have this severe pain, this back pain, which is holding me, and I have taken so many drugs, and none of them turns to relieve my pain. So again, of course, with this pain, you probably need morphine, which is an opioid given as a tablet. And again, morphine was added. So it stormed out, and so what I'm doing, but I'm just sitting where I'm here. And here just some people, they are going to die and they are going to die in pain. So this story is a story of all of the physicians who are sitting here. We have the skills, we have everything.
Professor Kiros, the Lancet, a very known journal, they had this month, last month actually, January, an appeal to all the leaders, healthcare for Ethiopians in Tigray, and there is, this very stringent blockade, humanitarian blockade, transport blockade, communication blockade, economic, financial, including what Dr. Hailay was mentioning, that those who have their money in the bank account, they can't even access it because it's blocked. So given that, what are we saying in terms of who should do what? You can maybe start with the international community, but you can also add on what Dr. Hailay was mentioning before. You are muted, I guess.
How about now? Can you hear me?
Good now.
Yeah, okay. Thank you very much for that. Yeah, so I think, the picture is really clear. It's a very, very grim picture. So who should do what is actually a very, very interesting question. And it has many, many layers. I think, before I go to that, actually, you said no communication. That's a very, very important aspect. So people obviously cannot access their funds. Even if they can access their funds, they don't have access to medications and to basic services, and even sanitation services, electricity, telephone, all that is actually non-existent, right? So I think, first of all, first and foremost, I think the biggest important step that the international community has to act on, and all people and organizations in influence have to act on, is really lifting the siege and the blockade, both physically but also in terms of the communication. Because all this, we're trying to get information in trickles from what gets out, but we don't have a full picture. And because of that, everything is being done in the dark. So I think the clear separation of humanitarian issues and medical issues from the other complex issues has to happen. There is no reason and there is no justification for actually, keeping people hostage in terms of their survival, in terms of what they eat, and if they are sick and how they can get medication or not. So in terms of what needs to be done, clearly the international community has a very strong, responsibility. And of course, it goes without saying, the federal government actually also has to allow unfettered access of all services, and especially medication, since we are talking about the health system. I think so. Those are actually the two big pillars in terms of who needs to do what. Now, if and when these initial and essential actions are taken, there is a lot to be done, both in the short term by the Tigrayan society, by the diaspora, by everyone involved, all well-meaning people, in terms of knowing what exactly happened, assessing what the need is, and planning for recovery and reconstruction, and try to actually dig out of this, bottomless pit that, the Tigrayan society actually finds itself in. And these are all, as Dr. Hailay said, things that are not collateral. They didn't happen, just by accident. They are systematic and methodically done, and therefore, they have to be reversed, and there has to be accountability. But first and foremost, of course, people have to eat, and people have to get basic services, and that should be the highest priority, in my opinion. You're on mute, Professor Getachew.
Thanks. On the same token, Dr. Hailay, you mentioned about the general mentioning that was purposely done. So, given the government of Ethiopia is in that intentional destruction, of course, with collaboration with the government in Eritrea and Asmara, what is your, on behalf of those who are protesting, those who are actually washing again and using what was supposed to be disposable, gloves and all that stuff that is meant only one way, is being reused in hospitals, in whatever hospital we have in Tigray. Yeah. So what is your message in terms of what the international community should do?
Yeah, I think it's, I don't have a different opinion from what Professor Kiros has been saying, whatever it is, what the federal government is doing is unlawful. It is against, all the declarations. It is against all the humanitarian conventions, right? So, yeah, they have to differentiate, and I would say they have to stop, committing what they have doing. They have to stop committing the genocide, right? So I think number one, they have to lift the siege, including the medical siege, and that's priority. Like, you can't use basically, hospitals as a tool for your war. You can't use health system in general as a tool for war. So I think the number one priority, the medical siege should be lifted. So that goes to the federal government, right? But the international community, yes, they should have to push, to the federal government, to lift that siege. And I know they have got a means, right? So they have got a means if they can. So that the so-called, concerned or being alarmed and so on, all these words cannot save the days of Tigrayans. So I guess the international community has to push, to open the humanitarian corridor in Tigray, and the federal government should also work the same. It's just against, all the conventions. And obviously, the Tigray government has also, to work hard with the international community and to keep the negotiations to cease the fire. So that's on the short term build, I guess. But for us Tigrayans and for the international community, we need also try to think the long-term strategy, as Professor Kiros has been saying, particularly with engineering the health infrastructure and the system in general, right? So there will be high number of disability as a result of this war. There will be high number of orphan children. So the international community who are working on the disability institution and working on the children institution has to keep an eye, for Tigray to restore and rehabilitate. And even if we have to also consider actually re-engineering the infrastructure itself. We can't use the cement, mud, or the cobblestones to rebuild all the destroyed health facilities. So we might think of probably, I don't know, using a steel or something. So we need to think re-engineering the system and re-engineering the infrastructure. And so, Tigray is already under-resourced from the very beginning. So we need help from the international community, and the international community has to consider that. And obviously, we have to also think about the capacity building. If you see, from the very beginning, as I said, it's a low-resourced institute. It's a low-resourced setting. One doctor is allocated for about 45,000 population, right? Which is way far from what WHO recommends, even though it's a good number compared to the sub-Saharan Africans. Not only that, because of the war, the medical colleges have already stopped. So, health workers were not graduated at least for 2 years. So imagine, it's already low resources, and the medical colleges already stopped graduating medical students, including doctors, nurses, and so on. But at the same time, even the health workers themselves, we have been mentioning before, some of them are displaced, some of them are killed, some of them are actually not functioning well because of no food, right? And plus, even a new specialization may be needed, like what I have been saying, including because of the war. You see, new anomalies are emerging, which the existing health workers do not know. Obviously, there is a high number of disability cases, which they need special training. So we can see the capacity building is needed at high stake, right? And for that, we may not, Tigrayans, the Tigray government by itself may not handle this. So obviously, we need support from the international community. But obviously, we need to consider, thinking also, linking our health system by technology. Nowadays, like the application of technology in health system is almost a routine thing. So we might also need to consider, and again for that we might seek support from the international community. I got the connection seems frozen from
Professor Getachew, I guess. Yeah, I hope we are live. So I think, while we're waiting for Professor Getachew, I think the issue of thinking out of the box and really getting ready, even though the immediate task is actually to really, save the people and try to somehow get the health system going to really serve the massive needs, in the Tigray region. But we also have to think about the future. As has been said, the skilled workforce that was actually developed over the last 20, 25 years. I remember going to the college and visiting and seeing improvement every year. That all is probably almost gone, right? So you're basically going to start from scratch when there is the most and even magnified and multiplied need for the skilled health workers, but at the same time also for the physical infrastructure, which is also decimated, right? So we really have to think as creatively as possible, as aggressively as possible, and we need to learn from other sectors and sections of the world that have passed through this, and we need to start planting the seeds. Otherwise, we'll be like the farmer who has to feed his or her family, but the seeds are even not planted yet. So we have to think of the short term, we have to think of the medium term, and we really have to think of the long term, because the last 15 months actually have found us very, very deep in the pit.
I'm so sorry. I was kicked out. We have a poor connection. As we were preparing for this show, I asked on social media for family members who learned about the death of their close family members, their medication, all that, and so we learned that the late Meles Zenawi, the Prime Minister of Ethiopia, his brother Fasah Zenawi died for lack of oxygen, and his sister Sassan Zenawi died for lack of medicine. So these are among the countless numbers of people. Because of the siege we mentioned, we don't even know the full scale of the problem. So what we try to paint, thanks to your professional and to your published work, is only the tip of the iceberg. But before we maybe finish, if you have additional final words to say, I'll give you the chance, and then we'll finish here. Professor Kiros?
Yeah, thank you very much. This has been a very obviously much needed discussion, and hopefully one of many to come. We have a lot of work to do, and we definitely owe it to the people to do the best we can, the most we can, to alleviate the current dire situation, but also to think about the future and think about a common bright future together. So I'm going to end by what Dr. Hailay also mentioned, and I mentioned as well. The world has given us lots of words in terms of alarm and concern. And in fact, there are some really moving words. For instance, I'm going to quote Michael Ryan from WHO. He was talking about the issue in Tigray, and he said, this is an insult to humanity. At some other point, Mark Griffiths, the UN Undersecretary General for Humanitarian Affairs, said Ethiopia is a stain on our conscience. And we have been hearing, alarms, concerns, very concerned, all the superlatives. But at the end of the day, if the international community keeps watching this and not be the solution, part of the solution, but really either be neutral, which is as bad as actually being complicit, because both of them actually simply lead to being complicit. I think the world needs to act. Otherwise, this is going to be a really, really, dark, point in human history. and it is unacceptable in the 21st century. So I think we all need to work. Of course, we should rely on ourselves, and we definitely should try to solve the problem to the extent that we can. But the international community also has a responsibility of acting the way it should act, and really live to the standards of humanity, if nothing else. Thank you.
Thank you, Professor Kiros. Dr. Hailay?
Yeah, thank you, Professor Geracho. This what we have been saying is actually the tip of the iceberg, right? So obviously, much things should be done. But before I think I put my concluding points, I want actually also raise the issue of the food insecurity, famine, and malnutrition condition just at glance, because Professor Kiros has said. So there is a fear to declare famine in Tigray, and I don't know why. If we really see what are the indications of famine, I think three things. Number one, if 20% of the households face extreme food shortage with a limited ability to cope, then that's one of the indications of famine. And is this happening in Tigray? And the answer is yes. Probably we have heard the report of Al Jazeera saying that they say 40% of the households in Tigray face extreme food insecurity. So obviously this number one criteria is fulfilled, right? The second one is the prevalence rate of global acute malnutrition. If the rate of global acute malnutrition is 30% and above, then that's another criteria to declare a famine in a given setting. And in Tigray, World Food Program reported just like a couple of days ago, actually 28 January 2022, they say the rate of global acute malnutrition in Tigray is 25.5%. So literally just 4% short. But Professor Kiros has told us almost 29.1, which is nearly 30% of the children have got acute malnutrition, right? So probably if you do a proper assessment, obviously that criteria of 30% of global acute malnutrition is going to be ticked off, right? And the third one is if there is a crude death rate of 2 persons per 10,000 per day. We haven't got any data on this, but obviously when you see food is used as a weapon of war, medicine is used as a weapon of war, and gender-based violence is as a weapon of war, and when the region is in a complete or in a total siege, it's just very easy to guess there is a days of 2 out of 10,000. So the three criteria to me are fulfilled, and the international community, including the World Food Program, shouldn't shy to declare famine in Tigray. I think I remember one of the organizations of WFP in Tigray was asked this question directly, and he doesn't want to say it directly that there is a famine. He just tried to say whether there is a famine or famine condition, like things, there is people are dying, or I forget the word. He say just it's a beast of animal, another face of animal or something like that. Anyways, he tried to allude that obviously there was a famine, even though they got fear. So yes, there is a famine in Tigray. That's what I want to add. Now, coming to my conclusion, I guess what we have to take a whole message in this conversation is, I think number one, as we have said, the entire healthcare system in Tigray is used as a weapon of war. We put already the criteria. And the second one is, there is a generational death in Tigray. I have already tried to show that, fetus is dying. So, unborn baby are dying, born baby are dying. We have already seen that the youths are dying. Youths were shot and killed and thrown over the cliff. And elders are dying because of lack of antibiotics. We have already said that 32% of the cause of deaths, the great majority of the cause of death were infectious illnesses, right? So you can see the at least 4 generational days. And to me, what's happening is, I say, genocide. So that should also be another take-home message. And I think Tigray is suffering and the world is watching. So the international health community has to put its responsibility, as Professor Kiros has said. So to conclude my conversation, I want to quote from the lances that you have displayed, and they said that a medical catastrophe is unfolding in the background of war, famine, and humanitarian tragedy. We demand that the relevant bodies, the UN, the African Union, WHO, and above all, I want to say above all, the Ethiopian government stand by the health workers and patients in Mekelle, and then in the entire Tigray, of course. And they said, it's heartbreaking to see that those with capacity to help do nothing, merely muttering that they are gravely concerned. They added, we write this on a Christmas day in Ethiopia, right? They wrote, during the Christmas day. So we write this on Christmas day in Ethiopia, which is of course in Tigray. And they said, we pray for deliverance for Mekelle and sick and helpless patients, of course. Thank you very much.
Great. Thank you so much for your time and for your insightful discussion. Like Professor Kiros was saying, this is not the end of our conversation. We need to continue with that. Whenever we get an update on the suffering, on the death, and on the siege in general, we will hopefully get you back again and to converse again on this, which is very close to many millions of people's heart. And as people more, the hope is as people understand more and know more, they will act more. So that's what I want to end today. Thank you for your time and good night from here.
Thank you. Thank you for the opportunity.
Thank you.
Have a good one.
Bye. You too.
You have been following us live on Facebook and YouTube. Topic today was the health state of Tigray with Professor Kiros Berhane from Columbia University in New York and Dr. Hailay Abrha from Flinders University in Australia. Before we finish today, I just want to announce we will have the usual weekly H panel on Friday, this time at 8 p.m. Since last week, 8 p.m. Eastern time is our new time, weekly time, Friday, 8 p.m. Eastern time. And on Saturday, I'll be back with the Tigrinya show. And the Tigrinya show in Sambet, Miss Arba'ata Gaishi na Khanizararab, Arba'ata Gaishi, Kultium, Kadmazi Mazemi Faltium, and YMD Media. Come through Allahum of the screen. Miss Hailu Kabeda, Kapsal Saiwayana, Kabrom Zabib, Kapaitona, Kamun, Dr. Gabra Mikael Gabra Muskalin, Mercy Ekidanan, Tigray, Abe Allah, Labe, Bhamit Thread. Bizibel Khanizarabina, Kadam, Saat 12 p.m. Eastern Time. 12 p.m. Eastern Time. I love you. Natna YouTube kid kulturi wat khali khum schedule khoyni 12 p.m. Eastern Time, New York time. Miss Agashay Khanizarabina live. Hailu Kabada, Kabram Zabib, Dr. Gabram Mikael Gabram Muskalin, Mercy Ekidanan, Kidanan Khanizarabina, Tigray Abella. ላበይ ብኸመይ ትኸድ ዝብል ክንዘራረብ ኢና ሼር ግበሩ ላይክ ግበሩ ሰብስክራይብ ግበሩ ብዙሕ ሰብ ሰብስክራይብ ኣይገበረን ሕዚ እውን 14800 ገለ ጥራሕ እዩ እኒኦ ንብዙሕ ሰብ ኣባፅሑ ካሊእ ፉል ታይም ዝሰርሕ ሰብ ስለ ዘየለው እዚ እንድሕር ተሓጋጊዝና ኢና ንብዙሕ ሰብ ክበፅሕ ዝኽእል እዚ ሚድያ እና ንብዙሕ ሰብ እስቲ ከም ስራሕ ቁፀርዎ እሞ ንብዙሕ ሰብ ኣብ ዩቲዩባት ላኸድኩም ሼር ግበሩ So that's the end of the show for today, and I will see you on Friday with H panel and on Saturday with the Tigrinya show, and more to come. Please subscribe, share, and follow us on all social medias. And the more people follow us, the more the algorithms behind YouTube share it to more people. So that is the call we have. And thank you for tuning in. Bye from here.